Hello, welcome to Ask Giri, the Physio Show, Season 2, Episode 11. Today, we're going to talk about breathing. Yes, your breath, your life. In this pandemic era, we do know that the importance of breathing and the lungs and all those things going on in the world right now. And also, we see a lot of patients having dysfunctional breathing pattern when we do their assessments. And 5 years back, I didn't pay much attention to breathing when I did the musculoskeletal assessment. But now, the things I know now, so every single patient I go through the musculoskeletal assessment, I make sure that I assess their breathing pattern and give them the breathing tips, because breathing is such an important thing, and we're going to see quickly why it is and then what we can do to make it better. So, what is a dysfunctional breathing? Dysfunctional breathing is inappropriate breathing without any other organic cause, right? If you have inappropriate breathing because of COVID, you will not call as a dysfunctional breathing, and because that's going into the different category. So for no organic cause, if you have a dysfunctional breathing or inappropriate breathing or abnormal breathing, it is dysfunctional breathing. We catch a lot of people like that, and that's what we're going to talk about today. So what are the symptoms of dysfunctional breathing or abnormal breathing? So they'll have a little bit of a shortness of breath, and not due to any diseases or organic causes, a little bit of a chest tightness, very frequent sighing or yawning because they have air hunger, we call it. And also a lot of relationship between abnormal breathing pattern and persistent musculoskeletal pain. And there are a lot of studies out there about connecting abnormal breathing patterns with lower back pain, SI joint pain, thoracic spine with your mid back pain, neck pain, pelvic issues. There's a lot of relationship with that. And obviously, if you don't breathe well, you're not going to give enough oxygen to the tissues. So tissues are going to be kind of having less oxygen, like as the food. So hypoxia. And also, breathing is the only thing which you can use to switch between your parasympathetic system and the sympathetic system. We actually discussed that in detail about polyvagal theory and the vagus nerve and all the different stages of that arousal stage and the parasympathetic sympathetic switches in one of our previous episodes in this Ask Giri the Physio Show. I don't remember the topic right now, but it's something to do with anxiety. So if you visit www.physioshow.ca, that's the website. We archived all the episodes, what we have done so far. Please visit that website and look for that anxiety episode, and in that one we kind of explained how you can use breathing to change your state from sympathetic to parasympathetic, from arousal to calmness. And breathing is the only tool we have to do that, and it's a very powerful tool. So we're not going to do much detail about that in this topic, so you can refer back to that one later. And depression and anxiety, because you're doing abnormal breathing, using unnecessary muscles in the neck and the upper chest, and quite agitated, I would say. Sleep disturbance and sleep breathing. How many people are using CPAP nowadays with sleep apnea and everything. How the breathing affects the sleep as well, and snoring and things like that. So the great study result with Hodges, he says the diaphragm having a multi-purpose role, right? One big muscle right here, it's a big dome right here. It's a huge dome like this, right? It's just a big, huge dome. It has great attachments, right? It attaches to your vertebrae in the back, about L1 to L3, and then it attaches to about 6 lower ribs. And also it has a lot of facial connections all the way to your hip muscles, your psoas major, your quadratus lumborum. There's so much facial connections. So that's why the diaphragm and the pelvis and the hip, they work together. So it has a postural function, and to kind of maintain the integrity and segmental stabilization and the core stability, because diaphragm is your ceiling or the roof. Because I already described it in one of the episodes that if you see this whole part as a pop can, the top of the pop can is your diaphragm. The floor of the pop can is your pelvic floor. And the front of the pop can is your abdominal muscles, your rectus abdominis, transverse abdominis, everything. Your back of the muscle is your paraspinal back muscles. So this container has to maintain proper pressure and proper function for you to do proper breathing, and also proper, what do you call this, the word I'm not getting it here, continence, yes. And also for segmental stabilization and core stability of the spine and core stability overall. So this is multi-purpose muscle, and also breathing and postural functions taken care of. So is taking, if one function is affected, if the breathing is affected, it's going to negatively affect the postural function as well. So if you want to have a good posture, you make sure you breathe well and you breathe right, using the right muscles, which is your diaphragm, not your neck and chest muscles. So a quick short about normal breathing. Normal breathing, you have to use your diaphragm. It works in both inspiration and expiration, right? And lot of relationship between normal breathing and core functioning we just talked about. And we breathe about normally about 10 to 14 times a minute. That means you're about 21,000 times a day we are breathing, right? And when we do something so many times in a day, we have to make sure that we do it right. Does it make sense? Yes. You can easily observe yourself. Just stand in front of the mirror and just take a normal breath and take a deep breath and see how you're doing. Is your chest moving? Is your shoulders rising? Is your upper ribs coming out too much compared to your diaphragm? You know that you're breathing abnormally and you need help. So that's the most important thing you need to change. You might be working out every day, 1 hour, 2 hours. You might be running and doing all those things. But if this is not reset properly, if this is not corrected, we are not doing a good thing for our body, right? And a lot of people nasal breathe as well, mouth breathe as well. So normal breathing involves nasal breathing. That means the air has to go through the nose and then go inside to the lungs, okay? And there are some benefits of nasal breathing. We're going to talk about that as well. And we also find a lot of mouth breathers nowadays because of the stress and anxiety and also the abnormal breathing patterns. People are breathing through the mouth, which is not good. And even kids nowadays, I catch a bunch of kids mouth breathing. So we need to teach them how to do it properly. And also inhalation is always shorter than exhalation. Exhalation you can prolong 2 times, 4 times, 6 times, 8 times. Depends on what you want to achieve in your breathing pattern. There are different types of breathing out there too. So why nasal breathing? Because our noses are meant for breathing, our mouths are not. Because see, if you put your tongue behind your upper teeth and roll your tongue on the roof of the mouth all the way to the back, the whole distance of the roof of the mouth, that is the floor of your nasal area. So that's how big the floor of the nasal area is. And that, it has a lot of pathways for the air to go through. And also it produces nitric oxide in that area. When you breathe through your mouth, you don't produce nitric oxide. Nitric oxide is very important, especially in this COVID times. Breathing through your nose is very important because the nitric oxide, it increases the oxygen binding capacity. And also nitric oxide is a vasodilator and a bronchodilator. That means dilate your airway areolas, right? All the air tubes it dilates, and also it dilates your blood vessels for the proper blood supply. So, only in certain parts of our body we can produce nitric oxide. The nasal area is one of the main thing, and it's very, very important. That's why breathing through the nose. And also the resting position of your tongue is very, very important. Like just close your mouth and just observe where your tongue is rested in your mouth. Normally it has to rest on the roof of the mouth, not the bottom of the mouth. The tip of the tongue should be behind your front of the teeth. Because a lot of our dental problems, orofacial dysfunctions, breathing issues happens, and also postural dysfunctions, it happens because of the bad tongue posture. Actually, I want to do a separate episode on just how the tongue and the oral posture affects your whole health and your whole postural system in the body. So, you make sure your tongue is there resting on the roof of the mouth, not on the bottom of the mouth. That's going to obstruct the airway as well. So small tips about the importance of nasal breathing. Nitric oxide is one of the main thing, and also it has a lot of filters in the pathway to filter all the pathogens so that you're not taking it into the lungs. And also it has a lot of antimicrobial, antiviral, antibacterial effects in the nasal epithelium when the air goes in, right? You cannot have that in the mouth. You don't have that in the mouth. So one study I want to share here by Kiesel and Rhodes, here it is, a lot of individual possess some level of dysfunctional breathing. There is no set methods to or consensus to assess and treat these people. But they want you to understand the relationship between the dysfunctional breathing and the musculoskeletal health. That is the most important. If your breathing is affected, your musculoskeletal health is affected. Even back pain patients, you just focus on the back exercises. Have you ever seen how your breathing is? Are you breathing normally or abnormally? How your diaphragm is functioning? Like I make sure every single patient, I'm looking at the breathing now. I made it like very sure, even when we do in-service with our colleagues, we make sure that everybody is checking on the breathing. It takes 2 minutes to check on your breathing when you stand, and we can comment on that and teach them what's the right way, what's the wrong way, right? And that's very, very important. So if you have a breathing issues, you're very, very prone to develop musculoskeletal dysfunction. So how do we go about it? Like what I do when I usually assess a patient, kind of just observe them for any kind of a rib flaring. So in here, especially here, I'm going to show you a picture of for the rib flaring too. So look at this, that's a rib flare, right? And you see the one side how it's outward and upward, especially the lower ribs is projected up. You will notice this in you, and you check yourself in the mirror and see if you have the rib flare. If you have rib flare, you know that you're breathing not right. Right, so that's very important. And infrasternal angle, this angle here, we measure, we work on that area to see how things are, if it is so constricted or it is in a proper angle, less than 90 degree or more than 90 degrees is important here, right? And we check on observation how are they using their neck muscles or shoulder muscles, are they raising it up, are they using the upper too much? And we check the breath hold time. You need to be able to hold your breath for more than 25 seconds. That's another self check you can do. Right? I'm trying to give you as much as self-help things here by checking your breathing pattern in front of the mirror, check your breath hold time, check your rib flare, and so that you can just self-assess and see where your breathing is at. So that's how you help yourself, right? So if you can't hold your breath more than 25 seconds without any cardiopulmonary issues, you need to work on that. You need to work on your respiratory muscle training, right? Talking about respiratory muscle training, we use quite a bit of this. It's called Breather. It's like $50 in the Amazon. So there is a lot of different levels, 5 levels here, 5 levels here for inhalation, exhalation. It's a great device. If you like working out, if you like exercises, if you want to work out your breathing muscles, this is it. And we're seeing a lot of post-COVID patients now. I have about 15 patients right now. Everybody has one of this. And plus, a lot of my athletes, I prescribe this to. Anybody I feel that they can work on their breathing better, Breather is a very good device, and I have no financial attachments to this device, but I love this because it's a small one, it's tiny and it's cheap and it helps a lot. That's why I prescribe this to my patients. They're helping quite a bit. And we put our hands on, we palpate, we see how the lung expansion, chest expansion at all different levels. We can measure it. It should be more than 5 centimeter at the axillary level, nipple level, lower level, and we auscultate. We see how the breath sounds are, and also we check how the movements, how much separation is happening on symmetry of breathing on both sides, how much expansion is there, right? And we call something else manual assessment of respiratory motion, that we put your hands on, we check the symmetry of movements, and I'll show you another slide for that. Yeah, and also we check for the rate of breathing, 10 to 14 times per minute, regularity of breathing, are they using the upper chest more or the lower chest more or abdomen more. All these things we can use with our hands on the patient's body manually. We can check on those things. And also a lot of people who are upper chest breathers, abnormal breathers, will have the first rib elevated because they use the scalene muscles quite a bit on the neck. The scalene muscles attached, it is on both sides attached to your first rib in there. So it keeps the rib elevated on both sides. So it's easy to check as a physical therapist and a manual therapist if your first rib is elevated or not here. And we can do some manual therapy to work on depressing the first rib, because you do have issues. If the first rib is consistently elevated, we talked about the entrapment neuropathies. Last episode, we talked about some peripheral nerve injuries. If you haven't watched that, go back to physioshow.ca or YouTube channel, check it out. We talked first rib is very important because of the approximation of the first rib to a lot of neurovascular structures coming out of the neck into that upper limb, right? So that's why it's very important to make sure first rib is in place. And SFMA, and I am certified in SFMA, Selective Functional Movement Systems, our assessment, and FMS. So we use quite a bit of this in all our clinics, and a lot of our colleagues also certified in this. And this is basically what it is basically like we go through a lot of movement patterns to identify dysfunctional movement patterns and correct them and treat them and teach the patient how to move right. We do a lot of screenings, neck screening, upper limb screening, and then we do multi-segmental screening, and also single leg stance, one of my favorite thing to check how stable you are, and squatting patterns, right? Those are the things we check, and then we put that together, breathing and the movements and what is missing things, and we will teach the patients how to help themselves. So, and if you find that you are breathing abnormally and you have some movement dysfunctions or musculoskeletal dysfunction, please consult your physical therapist to go through a good breathing or respiratory assessment, and then they will give you enough tips to help you to breathe better. So, and also you as a in the receiving end, if you want to check how good your breathing is, you can Google this self-evaluation of breathing questionnaire, sub-Q we call it. You can print it out. It's just a one-page questionnaire. It has about 25 questions here. You just answer yourself, right? Answer yourself and see what is your score. Score of anything more than 11 on this questionnaire, that means you have some breathing issues, some abnormal breathing issues. Then you can take help from your physical therapist who trained in respiratory field, right? So this is a very good tool for you to self-evaluate your breathing as well. On the other things, observing body scanning in front of the mirror, observing the breathing patterns, rib flare, and also breath hold time, and also this questionnaire. So you are basically doing a self-breathing assessment, and if you find something is not right, you take professional help, right? That's very important. So intervention, when the patients come to the physical therapist, we test them, right? We assess everything, we treat them, and with respiratory muscle training, movement dysfunctions protocols, whatever we need. I should not use the word protocol, because protocol will not work with a lot of patients, because everybody is individual. So individualistic treatment. We take you, we assess you, we treat you. And what you need, your body needs, because everybody's baseline is different, everybody's movement pattern is different, everybody's mobility, stability and motor control pattern is different. So we cannot plug a group of exercises and throw it at everybody. It doesn't work that way. So it's an individualistic treatment plan. We treat like that. Sometimes when we're treating like that, we might have to reset sometimes. If you have to reset, we'll reset that. Then we retest how the treatments are working for you. Are we making progress? We kind of objectively and subjectively check if you're moving towards your functional goal. And if you are, you're good, keep going. If you're not, we redesign it. We redesign the pathway and then keep going from it. It's kind of a simple tool to how we approach a condition. It can be any condition. So then we expose the patient to different types of exercises, right? When we expose them to exercises as a neurodevelopmental therapist, and the neurodevelopmental framework is very, very valuable, and a lot of research and studies coming out there, even in the orthopedic rehab, how we can apply the neurodevelopmental sequence. It only makes sense to apply that sequence to help people in their exercise terms, right? What is the neurodevelopment sequence like? How we grow up as a baby, right? After our birth, right? We are on our back first, then we kind of turn our head, roll, then we go on our tummy, then we lift our head, get some neck control, then bring our body up. Slowly we will raise our body. We will raise our body from the ground by reducing the base of support and taking our center of gravity like a little bit higher from the ground, right? Our center of gravity is in front of our tailbone, second sacrum we call it, tailbone. That's where the center of gravity is. When we lie it's here on the ground, then slowly by different development patterns, from lying to standing, we increase the height of the center of gravity and also decrease the base of support. That's why from lying down to we come onto our 2 feet. That's the neurodevelopmental sequence. Every baby will follow that. We call it developmental milestones, and that's the same kind of thing we use even in the orthopedic rehab when we're prescribing exercises, right? And with this all about the stability and motor control. And do not forget, breathing is your first stage of motor control. When you come into in this world, we first cry. That's the first sign of breathing, because that's what we do first. And we find out what's your movement baseline, and we progress exercises gradually. And if you have to reset, we'll reset. And as I said, normal breathing is the most effective reset. Okay. When I say neurodevelopmental therapy sequence or NDT sequence, we start the exercises on your back or on your tummy. And also you can use bridging and things like that, all fully supported. We can do a lot of things, even in breathing retraining in that position, right? And then we can go to a suspended position, which is you elevate your center of gravity a little bit more and reduce the base a little bit more, maybe a plank position, forward plank position. It's a suspended position, right? And also that we can use for different, and also going on hands and knees or all fours we call it. That's a suspended position. You're suspending your trunk by hands and feet. So for babies, that's the way they go for crawling and things like that. So that's the suspended position. We use that breathing techniques and other exercises in that position. Then we go to the stacked position, which is stacked as your kneeling position, kneeling or half kneeling, right? They're all stacked position. And we do exercise in them. The great exercise we do in our fundamental movement screen or FCS, fundamental capacity screen, is tall kneeling, we call it, going on kneels. And then we give them a kettlebell, a 20-pound kettlebell to hold here and rotate and work on the breathing as well. Those are things we do as a corrective exercises for breathing retraining. And that's a little bit of a higher level. We can talk about that. So stacked position like kneeling, half kneeling, those are all stacked positions, right? Tall kneeling. Then from there we progress to standing exercises in standing. It can be a breathing exercises, respiratory muscle training exercises, or other movement dysfunction correctional exercises. So this is the sequence we run the patients through in the clinic for any exercise program. Any condition you take it, we can progress to that. And sports specific exercises are a little different. Athletic development is a little different, but otherwise this is the sequence for neuro rehab or ortho rehab. It doesn't matter, right? I told you before itself, like, how many of our patients, they roll as an exercise. They roll on the ground. There's a proper rolling techniques, and the rolling helps in a lot of things which you find deficient later in so much rehab. Your hip, knee, ankle, trunk, neck, you call me anything you want, right? If you can't roll properly, you can't do a lot of things properly in standing. So there's no differentiation between a neuro rehabilitation and ortho rehabilitation. It's all one thing, and there is no ortho rehab without neurology, is it? So I just want to show some light on that, and also give some credit to Jacqueline Shakar. Like, some of this content is from his presentation as well, and also thanks to MedBridge for the image, the copyright of the image, the rib flare image I put it for the MedBridge as well. So I hope you got some useful points about breathing. What is a dysfunctional breathing, how you can identify a dysfunctional breathing, and how you can help yourself, and also if needed, please take help from a professional to help yourself. Breathing is very, very, very important. So if you haven't visited our website, please visit physioshow.ca, and a lot of important information and episodes are all archived there. And if you have any questions, please email me, giri@physioshow.ca. If you're interested in any topics, anything you want to discuss, or if you have any questions about your musculoskeletal health or neurological health, please email me and I can get you the answers. If I don't have an answer, I'll refer to someone who can give you that right answer. So otherwise, things are opening up. I want you guys to have a great summer. Enjoy, have fun. See you in the next episode later this month. I haven't decided the topic yet. I'm leaning towards more into the golf, but we'll see how things are going. See you guys. Bye. Have a good one.